Hi guys, so I want to build some programming in here that is going to be about muscle maintenance for aging. It's also going to be a rehab system for those that may have joint issues in the areas that I'm going to be working with. And also it is going to be a preventative measure for you to be able to age well. A lot of us, as we age, I'm nearly 40, we tend to get idiosyncrasies, but we can release those idiosyncrasies and pain areas in our body if we have the right programming and right exercises. So I'm going to tap on the knee at the moment, and this is going to be phase 1, phase 2, phase 3. Now in this first phase, we are going to be doing some stretching and releasing with a foam roller. Now, this will help us to release any tension above and below the knee, which can help with regards to knee pain, because often pain where it resides is also caused by areas above and below with muscles and tension in our body. So firstly, we're going to do a quad release. You're going to have a foam roller and you're going to lie and do a straight quad release here. And so you're going to lie on the foam roller. We're going to only do one leg. So if that's the case and you have a long roller, you simply scoot it along here onto the side that you're not using, your leg comes out to the side in this motion. And from here, what we're doing is we're keeping our leg bent and flex your foot, and you're going to roll up and down for 1 to 2 minutes on any tender spots on the front of the quadricep. And this will help you to release any tension that will be pertaining to pulling the knee and causing issues in the knee. So everywhere that we have tension in our body, or maybe we have joints that are pertaining to or often incurring, limitations, we have to look at how to release around it. So once you've done one leg for 1 to 2 minutes, you simply pop over to the other leg. I'll show you from the back a little bit here. So the leg is up, flex point, you can choose. I find that when I flex is better, and I'm just rolling up and down here. Again, on the front of the knee allows me to release out and allows me to be able to roll and feel any tension. May be wise not to make sure your clothes don't get stuck on this as you go through here. So just rolling up and down. And 1 to 2 minutes is enough to be able to get that release. And once you have done that, we're going to go into the next method, which will be to be able to release onto the lateral side of the quadriceps. So we've got the outside, which is the lateral side. And you're going to go similar positioning, but you're going to lie slightly sideways. And you're going to bend that leg again and roll up and down. Just moving through any tension point of view that you might have. And I can definitely feel that my legs are tight. I don't have any knee issues at the moment. I did as a child, and I can do sometimes when I overwork. So I find this to be very functional. In fact, all joints tend to get a little bit of consonant issues. So again, taking it to the other side, and this is phase 1, when you are initially feeling knee pain and you've been dealing with knee pain. We start with the mobilization, and then we're going to build into that. And we're starting with some foam rolling, and also the stretching will come after this. And so make sure as you're doing it, you're slightly turning here on your side. Again, bending that leg adds the extra pressure into the quadricep, and just rolling it out. Once you've done that, we're going to work into going on the calves. So the calves can be either one leg, and you're using the other leg to be able to support you so you don't put too much weight for 1 to 2 minutes. And then if you are swapping over, do the same on each side, rolling up and down the calf, turning your foot in and out. So as you do it, you want to roll up and down the calf, and you want to turn your foot in and out as you do it, so you get all of the calf. And if this is not enough and you want to be able to go a little deeper into that calf, is place the other leg on top or foot on top and really push into that roller, and you can change sides here. So this is working into releasing all the tension. Beautiful. So again, 1 to 2 minutes. You could do 2 sets if you want to do it. Now from there, we're going to go into the stretching. So you will no longer need this unless you need it for balancing. And with the stretching, the first one is the quad stretch. So I'm just going to show you the lower leg here. So you're going to stand here and you can hold on to something or balance. And you're simply going to keep your hips even. So the hips need to be even and the knees need to be even. And from there, if you have the balance, you bring your leg up, knees together, and then you're pulling back. And you're pushing your quadricep forward. You can flex or point, and you can also grab on with 2 feet. Now, if this is too difficult, you can wrap something around the foot, or you can hold on to something. Also, if this is too difficult, again, you're holding it for about 30 seconds to a minute. You could lie on your side here, and you can take the stretch, exactly the same approach, but without balance needed in it, and holding here, and you're laying out and stretching the quad. Remember to push your bottom forward to add that activation. So this is going to be really important to release off as we go through. And then from there, I'm going to use, this is a handstand block. So the handstand block is going to help me to place my foot up for a standing calf stretch. Now, you could also use a wedge board or a different type of block or a small ledge to be able to do that. And you're going to stand here, putting the block down, and you're going to put your foot on it here, and you're going to lean into it, and you're going to feel a nice stretch. So from behind, if I'm doing it, you've got this nice stretch here, okay? And you can bring that leg back, and I'm feeling a nice strong stretch. If you want to intensify it, you can bend this leg and lean forward into it. That can change the intensity that you have. So it may intensify or it may not, depending on you as what you feel. So again, bending that leg, leaning the hips forward, keeping a nice straight back, and leaning into it more. And that would change the intensity and the feel of this calf stretch. And finally, from here, we want to be able to stretch out into the hip flexor area. So this is the hip flexor area here and the side body. So it's a lateral flexion stretch. And what you're going to do, I like to do this on my knees, but you can do this standing, is you cross your leg over, hand on the hip, and then from there lift up and over, and you're feeling a nice stretch as you push this hip out. So you're pushing this hip out. Now, I find it as a much more comfortable stretch to do on my knees. So I cross my leg here, pushing my hips forward. Now the balance is difficult for some people here. And then a hand comes onto the hip and then you're pushing over. So this adds a little bit of intensity for me. However, balance is difficult, so you may want something to hold on to or prefer the standing. And I can feel it right through my hip flexors because I'm pushing my hips forward and through my side body. Okay, so as you do that, make sure your hips are coming forward and not back. So this is phase 1 to approach knee pain or to avoid knee pain or pre or rehab for knee pain. So doing this regularly will start to alleviate some of the tension that you may have from tight muscle groups around the knee. I hope you enjoy, and don't forget to subscribe and ring that bell. Next, I'm going to bring you phase 2 of exercises for knees and maintenance of knees for aging well. Namaste.